Welcome to Doctors at Work. My name is Matt Daniel, and this podcast is part of my mission to help doctors create successful and meaningful careers. And today's podcast is about how to deal with major life events. Now, my guest, Andrew Kadar, is an anaesthesiologist, and he quite unexpectedly developed severe heart disease needing immediate open heart surgery. He has written a book, Getting Better, about his experiences, where he discusses emotional, spiritual, and psychological foundations of getting better. In this episode of Doctors at Work, we talk about the fact that as physicians, we struggle to be objective when it comes to our own health. And his tip is to ask what advice you would give to somebody else if they had the same symptoms. Part of the issue also is our self-image. For if we see ourselves as a healthy person who cares for others, it can be challenging to accept that you are the one in need of care. And I love his attitude for recovery. He suggests accepting what is, focusing on solutions, and asking, so what do we need to do next? Welcome, Andrew. Tell me a little bit about yourself.
I'm an anesthesiologist in Los Angeles at Cedars-Sinai Medical Center. I've been there for over 40 years now, although the events that prompted me to write a book of illness, that was about 14 years ago. I grew up in Los Angeles. I went to UCLA as an undergrad. I've always been very healthy. I was a college athlete. I was on the UCLA gymnastics team, competed for them. Then I went to Yale Medical School, did a residency that was split between Stanford and Harvard, Massachusetts General Hospital. Went back to Cedars and have been teaching on the UCLA clinical faculty and the Cedars clinical faculty ever since my residency ended.
Okay. And the topic for our podcast today is about dealing with unexpected life events. So tell me about your unexpected life event and tell me a bit more about the book that you've written.
Okay, so I had always considered myself to be superbly healthy. Didn't have any major risk factors. My father lived to be 94 and was in good health to the end. So I wasn't expecting any particular problems. And I'd been active. I'd run lots of 10Ks. And one day while I was working out in the gym, about 9 minutes into a pretty intensive workout on the elliptical, I started feeling some chest pain, kind of a little bit of burning under the sternum. So I stopped working out thinking, obviously I thought this about heart disease, but I knew I didn't have heart disease. So I basically wrote it off. And then a couple of days later, I went down to the gym and the same thing happened after about 9 minutes again. So I thought, okay, I don't have heart disease, but what would I tell anybody else who told me they had the symptom history? And then the answer became obvious. I mean, I was pretty much in denial. I knew I didn't have heart disease. I didn't have high blood pressure. I'd never been overweight. I exercised. Didn't have any of the usual risk factors other than being male, and I was 62 years old at the time. So those were, but I had, with my father living to be 94 and never having had those kind of problems, I certainly wasn't expecting anything. And then once I started, then I had a few days later, I had a exercise tolerance test, and that showed it was the ugliest EKG I'd seen in my life, with ST depressions everywhere. And then had an angiogram the next day, thinking that, okay, maybe I need an angioplasty, but I'll be back to work the next day. Yeah. And it turned out to be triple vessel disease with basically a large occlusion at the takeoff of the LAD, so it needed to have open heart surgery. And that was a big surprise to me. And of course, one of the things that while I was in college, I thought that doctors always exaggerated how long it takes to get well, because all the gymnasts that I knew, they'd get back to the gym in half the time they were told it would take to recover it. Yeah. But I didn't realize that once I got into medical school, I realized that my sample hadn't been representative, because young athletes who are motivated and are very healthy are going to get back faster. So so I figured, okay, I'm gonna have the smoothest recovery and fastest recovery of anybody who'd ever had open heart surgery in the history of the world. That didn't turn out so well either, because I ended up having a bunch of complications along the way. Usually people got out of the ICU the day after surgery. It took me about 3 days to get out of the ICU. People go home. I think at that time, the standard was about a week to get out of the hospital, and I think it took me about 10 days. So things took longer, and I had more unexpected complications than I expected, and they were unpleasant, to say the least. So I kind of got to have an experience of being on the other side of all these things, and it was not the pleasantest experience in my life, but I think that I managed to maintain a sort of a positive attitude throughout. I knew my goal was to get back to my normal life, and that happened.
Mm-hmm. Mm-hmm. It sounds like it's been quite an ordeal, Andrew, and but also sounds like you've extracted some really, really important learning from that. And the stuff that you were talking about, I thought to myself, yeah, that sounds really familiar. You know, that I also have colleagues that sort of come to work and they've had chest pain and they said, no, it's not me. And, you know, and sometimes they've not even been healthy colleagues, you know, sometimes they've been overweight, alcoholic, smoking colleagues who said, no, of course I haven't got, you know, that doesn't happen. And I'm sure that, you know, I do that personally as well. And I suspect huge numbers of us just minimize and we deny that we're ill. And I mean, why do you think that we do that? You know, why do we not treat ourselves in the same way that we would treat the people around us?
You know, it's kind of a difficult question, but I think it's hard to be objective about yourself.
Mm.
And that's a real issue. And it's a real issue for some very, very bright people. I think, and it's not just in heart disease, it's also in other things. You know, this lump I have, it's not so hard, it's not so big, it'll go away.
Mm.
And you have some brilliant people, for example, Steve Jobs, you know, the founder of Apple, or the co-founder of Apple, a brilliant man, obviously. And yet when he was diagnosed with very early stage pancreatic cancer, he decided not to have surgery for I think about 6 months or so, during which time it became inoperable. So
Yeah. And I know that our regulators always talk about this idea that we shouldn't be treating ourselves and that we should formally seek medical attention. And you know that kind of very much resonates. You know, that idea that you can't be objective when it's your own health. You know, we minimize things. The other thing, I don't know if it happened to you, but if I think for sort of some of my own things that have happened to me personally, I probably minimize and ignore, and then I flip into panic and catastrophe. I don't know sort of whether you've seen that. So like there's no happy medium where just sort of just go at a leisurely pace. So I say no, it's nothing, it's nothing, it's nothing, and then I kind of think, oh my God, this is the worst thing ever. It's a complete disaster. Did you have that experience too?
I actually didn't.
It's just me.
I was always hoping for a good outcome. The thing that worried me the most is after my surgery, I couldn't eat. I couldn't swallow. I mean, each meal was just a disgusting ordeal of coughing and spitting, and I couldn't swallow. And I wasn't aware. I mean, I knew a lot more about heart surgery than the average patient would, but I wasn't aware that swallowing difficulties are sometimes a problem after open heart surgery. And so I didn't know whether this was how temporary this was going to be. And it was very reassuring when finally I got an ENT consult, and he told me, you know, he'd seen this before, and he'd never seen it last over a month, and it just goes away on its own. It's miserable. There's nothing you can do about it, but it goes away.
Yeah,
So that was probably the thing that I was most concerned about,
yeah,
was when I couldn't eat. It was very, very disturbing, to say the least. And of course, people brought me that I'd get a basket of fruits,
Yeah,
and they
yeah,
looked great, and all my guests enjoyed them. The nurses enjoyed them,
yeah, yeah,
and I couldn't eat any of it.
yeah. And it's interesting that there's something there about when we're explaining procedures or interventions to patients as doctors, that perhaps some of the things that we sometimes talk about um, may not, or some of the things that we minimize might be the very things that actually to patients would be huge. Yeah, because I can't imagine that swallowing issues is a big part of the risk discussion when it comes to having open heart surgery, because my guess would be, well, you might die, or you might get another heart attack or a stroke. That would, I mean, I'm not in that world, but that would be my guess. So I can't imagine that swallowing difficulties afterwards would feature largely on that consenting discussion, because the focus is going to be all on that, survival and efficacy. And it's a really timely reminder, for those of us that do consent people for procedures, which is probably most of us, to kind of to just recognize there's a whole range of different things, and it's not just about will you live or will you die, but there's a whole range of different things that really, really matter.
Yeah, and I think there's a whole thing about how many complications and which complications you should discuss. I mean, think about it. If you talked about the potential complications of crossing the street, you'd never cross the street, because lightning might strike while a telephone pole hits you over the head, while a car
Yeah,
crosses and kills you. It just, you can't talk about all the unexpected things that might occur. You need to address them as they come along, and that actually became sort of an issue. My wife, when after surgery, asked the surgeon, what could happen, and he told her, well, he might need a transfusion, which actually I didn't need a transfusion, but that didn't sound all that terrible to her. But it's a question of what else should you tell a patient or their family, because obviously the worst thing that can happen after open heart surgery is not just a transfusion,
yeah,
but do you discuss things that are relatively unlikely to happen and scare people? I mean, I'm an anesthesiologist. There are some people mentioned that you could die in every case. Well, it's not necessary to scare a healthy person who's having a hernia surgery that they might die. Yeah, they might, but the odds are it's so unlikely that there's no sense in creating that level of anxiety. Obviously, if they ask you, you can talk about it. But again, I liken it again to crossing the street. Can you imagine the informed consent with every possible complication that can happen for crossing the street?
yeah. I hope you're enjoying the show. Please click subscribe so you'll be notified when new episodes become available. This podcast is part of my mission to help doctors create successful and meaningful careers. You can be part of that mission too by forwarding this show to one person who you think might benefit from listening. Thank you. Now on with the show. I'm interested in for you as a patient on the receiving end of a consenting discussion. What tips would you give doctors as a patient on the receiving end of consenting?
I really didn't change my approach on that. My approach is basically to mention the most likely complication and ask them if they have any questions or they'd like anything. And some people want a fairly detailed account. Can this happen? Can that happen? But a lot of people don't want to hear about those things, just I don't want to know about it kind of attitude. So I think it's very individual, and sometimes you have to take a family member aside and talk to them separately if they want to talk to you separately about what might occur. I'm not in the school of trying to scare people about medical procedures, because most of the time things go well. We wouldn't do the procedure if we didn't think the patient would benefit.
Yeah,
So you don't want to discourage them or scare them to the point where it's going to have a negative effect. And actually, one of the things that I talk about is if you're in denial about your illness before it happens, that can be a problem, because you don't get the diagnosis and treatment. But once you're in the hospital, like after my angiogram, I was in the intensive care unit before the surgery. And at that point, being in denial is actually not a bad thing, because you're less worried, you're less likely to get anxious. So in the ICU, I was thinking, okay, well, I have a life-threatening disease, but I'm kind of in the best place to have that. Nothing bad is likely to happen. And if it does, I'm kind of in the best place to be resuscitated.
Yeah. So it's really interesting because there's something there about the context. As in majority of the time, everything goes fine, and and we shouldn't lose sight of that if we sort of focused on a checklist of of stuff that can go wrong. So that strikes me as really important. And then also the I really like that, how much information do you want to know? Does this person want to know everything, or they want to know little? So that kind of personalization to how much do they want to know, or how much do they worry, or how much information they need. And then also that the timing of when the tricky things are discussed. Because you're right, because as you're about to be wheeled into OR, that probably is not the right time to to be adding a whole series of disasters. That's probably the time that you say, we'll look after you, Andrew, sort of see you soon. That it should be that kind of discussion, isn't it? Not, oh, by the way, here's 27 risks that might happen, and you'll be asleep in 27 seconds. So it's the timing of when it happens as well.
I just thought about something else in regards to why people might go into denial. And that really was a situation in my case too, because being ill can be destroy your self-image to some extent.
Mhm.
Because my self-concept was that I was a healthy physician.
Yeah.
I was not a sick patient. And that really undermines your self-image and how you see yourself. And in my particular case, I considered myself to be healthy, to be athletic, and somebody who doesn't have these kinds of problems to worry about. I wasn't expecting any major medical illness, certainly for a decade or two at
Yeah.
that point.
Yeah. Yeah. So I'm interested, can you sort of tell me a little bit more about how this self-image, because the self-image that all of us will have is, I'm a physician, I'm healthy or moderately healthy, whatever it might be, but I'm here to look after others. And then straight away that actually it flips on its side, doesn't it? All of a sudden, I'm not here to look after others, I'm here to be looked after.
Yeah, when I went back to work, and particularly a few weeks later, I was walking down the same corridor going to the operating room where I had been whittled down, and I sort of felt like there was triumphant music going on. Oh, I'm back. The universe is back in its proper place. Everything is back in its proper place. I'm not in the wrong
Yeah.
side of the gurney here.
Yeah. Yeah.
Yeah, it did for me. It very much was an undermining of my self-image, and in some sense, it undermines your self-image for life, because I can never really see myself as an unusually healthy person. I am healthy. I mean, I last year I was hiking in Rwanda to see mountain gorillas at 7,000 feet. But nevertheless, I'm aware that I have a tendency for atherosclerosis, and I need to watch that and be aware of that, which I wasn't that aware before.
Yeah.
I sort of, I had the illusion that wasn't an issue for me, because I didn't have that family history, and I didn't have any of the major risk factors for that. And it's really kind of a relatively young age to have the problem I had. And I don't know why, but it's, and it wasn't for, a lot of times it's people think, well, you must have done, a lot of my colleagues were asking me things like, well, did you do this? Do you have a bad family history? They wanted to have some reassurance that it wouldn't happen to them, what happened to me. And I can't give anybody that reassurance, because I really didn't have the risk factors that would be associated with that at the age I had it.
You talked about the idea of recovery afterwards, and how you expected of yourself that recovery would be much quicker. Is that about sort of self-image as well? That you had a self-image of yourself as this, you're better. You tell all the other patients will take 6 months, but not you, because you're so much better. You'll just take a week. Is that the same thing?
Well, again, I go back to, in my mind, I was still a young gymnast.
Yeah,
So I should get back to normal in half the time
yeah,
it takes the average person.
yeah,
It didn't turn out that way, at least initially. Now, actually, they told me to stay away from work for 12 weeks.
yeah,
And in reality, I could have gone back sooner.
yeah,
By about 8 weeks, it was like kind of an extended vacation. I mean, I still had a fair amount of pain. The cutting of the sternum it takes a long time to heal before so there was still like real tenderness over the center of the chest and some numbness. But as far as being able to walk around and do things, and it was around Christmas time, so I really got to enjoy all the festivities that most of the time, I wouldn't have as much time to go and see all the Christmas decorations around town. And while I'm in Southern California, so walk along the beach and things like that. So in a way, near the end, I was kind of enjoying it, but I also knew that, I had to get back to work. But if it had been important to me to get back sooner to work, I could have done it. But there was no real reason to push myself.
I'm interested. What motivated you to write a book about your experiences?
I wanted to help other people in the same situation, because I think it's encouraging to see that others have gone through this and come out well at the other side. And really, my story is a positive story. I went back to work. I have my life back, and that was my goal. My goal was to
Mhm.
regain my normal life.
Mhm.
And I think that's very possible after not just heart surgery, but any major illness or lots of major illnesses. And so I wanted it to be encouraging. And I also wanted to show that there can be setbacks along the way, and how is it, how to deal with them,
Yeah,
essentially. And my approach towards it was always, okay, I've got this problem. What do I need to do to get over it?
yeah,
And I think that's a good approach.
yeah. So it sounds like your approach is very much it's very positive and focused on solutions. Like earlier I outlined my thing where I go from it's fine to catastrophizing, whereas your approach is it's positive. It's thinking for hoping for the best, or thinking of the best and looking for solutions. That kind of mindset sounds like is helpful.
Yeah, I think, I mean, that was my mindset throughout was, okay, I've got this problem. What do I need to deal with it? And it's interesting, along the way, there was always one problem that was the paramount problem. So on day one, I woke up and it's like, whoa, this really hurts more than I thought it would.
Mm.
And then after a couple of days, the swallowing became an issue. And once we found out what the swallowing was over, I had a bout of horrible hiccups, but hiccups like I'd never experienced, hiccups on top of hiccups. I mean, it was a barrage of hiccups that would just wouldn't quit. And for a day and a half, our doctors tried various medications until we found something that stopped it. But then I'd sleep all day
Yeah,
from it because it was sedative as well. And but it's just um, there's always it seemed like there was always something that was like the paramount problem.
yeah. Okay.
And
And
then after that I had some thrombophlebitis from an IV site, so that became an issue because my white count got too high for me to be discharged. And it was always one item was always the paramount problem. And I think that's not uncommon, that even though there are lots of things going on, one thing takes center stage.
yeah. Um, I'm probably going to bring us to a close a little bit, and I'm interested in if you look at your experiences and your book and what we discussed today, what are the key things, for people out there that are facing life events, what do people need to think about? If they're in the middle of it, how do they deal with it? Your experiences, your book, or what we talked about today, what do people need to think about? And if they are in the middle of it, what would be your tips to help them manage it?
Well, I think the first thing is how to get over denial. And I think one way is to take it away from yourself, because it's difficult to be objective about yourself. And the way I got my diagnosis was to think, okay, even though I don't think I have this problem, what would I tell anybody else who had
Yeah,
the same symptoms? I think that's a useful approach. And it also takes you away from being overly paranoid, because if the symptoms are mild, you're not going to tell somebody to panic about it.
yeah,
So it allows you to be more objective if you think about it for somebody else. And then in terms of what happens along the way, I think having a solution based approach, I think is a good way to go. And my approach was always, okay, I've got this problem. I want to get rid of this problem. What do I need to do? And sometimes it's for pain, it's just you take pain medication and time. But for other things, when I had the swallowing issue, I wanted to know what was causing it and what was the likely prospect. When I had the hiccups, I needed the medication to get over. And in medical school, I hiccups are usually a minor nuisance, but in medical school, I found out that there were people who've had hiccups for years and years, and some people have even died from exhaustion. The diaphragm becomes exhausted, and they have respiratory distress. But when I first heard about it in medical school, I thought, okay, it almost sounded funny to me. But when I was having this barrage of hiccups, it was no longer so funny.
yeah,
There's a thing about it. Everything is funny so long as it's happening to somebody else.
yeah, yeah, yeah.
And when you go from a doctor to a patient, you realize the truth of that.
Yeah. And maybe one final thing then, as a patient, because you've been both a doctor and a patient now. So as a patient, what's your one tip to physicians?
I think clear communication and be an advocate for yourself, because when I first had the swallowing problem, I complained a couple of times, but it wasn't on top of the list for my doctors, and finally it was bothering me so much that I wanted to self-initiate a gastroenterology consult, but my doctor was fortunately very much approving of that, so
Yeah,
it wasn't an issue. But I think advocate for yourself and communicate clearly.
yeah. Wonderful. Thank you very much.
Thank you, Matt.